Hi everyone, so we haven't done any of these autocomplete FAQs for a while. So today I'm going to focus on something I've been given, breast augmentation, very often Googled subject. I haven't seen these answers, so let's start. Okay, can breast aug cause back pain? No, not really. You'd have to use a huge implant for that, and that's difficult in primary augmentation. So the answer is no. Can breast augmentation be done with local anesthesia? Yes, it could be. Particularly if we are, there are two planes, behind the muscle and in front of the muscle. In front of the muscle it's easier, behind the muscle it's a little tricky and difficult and painful. So I wouldn't recommend it. But for generally breast augmentation, I think general anesthetic is better. Can breast augmentation be done with fat transfer? Yes, it can. Today's breast augmentations are often called hybrid. So we put the implant and then we can put some fat along areas where we might think that the tissue is not thick enough to cover the implant properly and give a natural result. So we do that, but purely fat, I don't think it will be as reliable as an implant. Fat, as you know, gets resorbed. So I think it would be a good idea to still use implants if we want a more predictable outcome. Okay, can breast augmentation cause weight gain? Well, yeah, the implants weigh something, so when you have them in, you get weight gain, but not otherwise. Look, there have been cases of breast implant associated illnesses which are, at the moment, with all respect to anyone who is suffering from them, doesn't have any real medical evidence to back it, and some of these patients do complain of weight gain. But it's not something that we list as a common side effect. Can breast augmentation cause breastfeeding problems? Well, look, in theory, we're not really destroying any breast tissue. And in practice, we're not destroying any breast tissue. So I think that breastfeeding problems don't arise from breast augmentation. I think it's largely anecdotal that they do, but I wouldn't worry about this, and it's not something we discuss in our consultations. So can you breastfeed after breast augmentation? Yes, in a nutshell, yes, you can. You're not damaging any ducts, so really there's no problem with breastfeeding. That may not have occurred anyway. People with normal breasts sometimes cannot breastfeed, so it won't be the augmentation that's causing it. Okay, can I run after breast augmentation? Yes, of course you can run. In the early couple of weeks, if you want to run 3-4 weeks after, with good support garment, no reason why you can't run. Next one, can breast augmentation be reversed? Well, yeah, anything can be reversed. If you take out the implant, you reverse the breast aug, but it's not something people like to do because it leaves you with redundant skin. But in all cases, if that happened, we could do a breast lift and tighten the skin, although this does result in more scars. Yes, there's nothing really that is a problem in terms of reversibility of the implant augmentation from a practical point of view. However, from a cosmetic point of view, it's generally not advisable. Alright, so can you vape before breast? You shouldn't vape before anything. I mean, vaping is pretty much as bad as smoking. So I would say no, don't vape. But people do. So that's about it. Have a good one.